So I appreciate being included today. I am Carol Moehrle. I'm serving today in the capacity as the chair for the Public Health Accreditation Board. And I bring great wishes from Kay Bender, who is our CEO for FAB and not able to be with us today. As we endeavor into looking at the public health accreditation process and board and the standards this morning, before I start that, I just wanted to introduce to you or let you know who else serves on that Public Health Accreditation Board. You will recognize many of these outstanding individuals in our presence today. Dr. Les Beitsch is the current vice chair for FAB. Dr. Bill Riley is the current past chair for FAB. Dr. Paul Halverson is the past chair. Is that right? They kind of go in order over there. Bobby Pestronk is our NACCHO representative on the FAB board. Paul Jarris, the ASTO representative, and none other than our own, your own, Dr. Scutchfield serves also on the Public Health Accreditation Board. So you have many of the board members in presence today as we share our information. So if there are questions, I am going to turn to the rest of the crew. So we're going to start with what we really mean by public health accreditation. Accreditation, what we know, is the measurement of the health department performance against a set of standards that are nationally recognized. They're practice focused and evidence-based in those standards. We looked at a process that would include all health departments, state, local, tribal, and territorial. All health departments being measured against the same national standards and the same evidence-based practices. So what we really know is it's about time. We're trying to do some catch-up here, actually. If we look at the rest of the world out there, we know that education and medicine and hospitals and jails and law enforcement, they have all been accredited for many, many years. And it's time public health step up and make sure that this happens in our realm as well. So the Public Health Accreditation Board is actually a nonprofit voluntary accreditation organization founded in 2007. We're very young. The goal is to advance public health practice by providing a national framework of accreditation standards, again, for local, state, territorial, and tribal health departments. We have a goal. Our goal statement is advancing the quality and performance of local, state, tribal, and territorial public health departments. So before I share a timeline of how we got here, it's a good segue maybe for me to tell a little story. So we all know that any really important endeavor is never accomplished without the leadership and the commitment of a lot of people to reach that end. So as we look at how we've come with accreditation, it's taken a lot of people for us to get here. But let me give you a little analogy about an egg. So we just had breakfast, and there were maybe no real eggs out there. I don't know. But if you remember the last time you looked at one of those little eggs, it has the shell. It sits there. Nobody really pays attention. It kind of just stays in its little crate until we're ready to pop it open. Or it's actually being fertilized, and that little chicken is growing inside. But one day, if there's a little baby chick inside, that egg that sat on the shelf or in the refrigerator or wherever, incubator, for all that time, starts cracking. And out pops this cute little fuzzy chicken. So from the outside, we've looked at that egg and we've seen nothing. We think, oh my gosh, overnight, here is this little egg transformed into this baby chicken. It must be a miracle. How exciting. And all of a sudden the egg gets all this attention and the baby chick gets all this attention and everyone thinks that we have now overnight had a cessation. But if you look from the picture of the egg from the chicken's point of view, it didn't happen like that at all. From the outside, we think it's dormant. From the inside, that little baby chicken was growing and evolving and developing and changing all along until it finally broke through that little eggshell. What happened in one little simple step is a monumental event for a lot of people, especially that chicken. So I give that analogy because overnight that little baby chicken was exposed, but it actually had gone through a very systematic, planned, and a huge process to get there. Now, that's not a whole lot different than FAB. The analogy that you just heard is from Jim Collins' of Good to Great. I'm sure you've all read that and heard that before. But FAB also, public health accreditation, has been a methodical, planned transformation of public health. It began with a vision and the wisdom of a board of incorporators and our funding partners, Robert Wood Johnson Foundation and CDC. And these leaders had the vision for the work that we celebrated in September when FAB was finally launched and went live. It finally cracked out of its shell and became that little baby chick. So that analogy, we have been working at this for quite a long while. So you'll see from this timeline, in 2003, the Institute of Medicine's The Future of Public Health, we all have that on our shelves and have read that, I know, established a national entity to examine the benefits of accrediting governmental public health departments. Last night, someone asked, how many of the recommendations from IOM have ever been implemented? Here's a great example. This one has. In 2004, CDC identified accreditation as a key strategy for strengthening public health infrastructure. In 2005, an Exploring Accreditation project developed a model, and it was reviewed and identified and given feedback for the how do we look at accreditation. In 2006, the Accreditation Committee also gave its recommendations. Those were released, and APHA, NACCHO, ASTO, and NALBO all endorsed the recommendations, and those 4 groups became the Board of Incorporators for FAB in 2006. 2007, FAB itself was incorporated. In 2008, the FAB work groups and committees began working on elements of accreditation. 2009 and 10, we did beta testing of the standards and measures that we framed our development around. And in September of 2011, not just about 7 months ago, FAB began accepting applications for accreditation. We have come a long way in a short amount of time, but taken lots and lots of leaders, scholars, mentors to get us to this point. So, since September, this is a map of our nation. In the blue states, you'll see the states that actually have had someone push the button on the accreditation process, like Georgia has. The 63 that you see here was from March 16th. As of last Tuesday, we actually had 68 applications successfully submitted in those areas. 3 states, 1 tribe, and 64 local health departments have already pushed the button. They're out of the gate, off and running into being accredited. So we're very, very excited about that. If you see your home state in there, you can feel good about that. So there are huge benefits to accreditation, individually and collectively as a system. One of them is reaching the standard of excellence that we now have established in this national voluntary accreditation process. The credibility that we see is amongst our elected officials, our governing entities, and our population and our citizens at large, feeling very confident that we are a credible public health agency when we are accredited. We know that this accreditation process also gives us a roadmap that maybe we haven't had before for all public health to follow. The things we should do and should do well are documented in these standards and measures for accreditation. We have adopted a culture of QI, and we're raising the bar on performance with these national standards.